Welcome back to the Your Health radio and television program. I'm your host from the Monterey County Health Department, Emily Sciolto. Earlier we spoke with public health nurses Linda Payne and Faye Stallworth about the Monterey County Public Health Bureau Visiting Nurses Association Clean Hands and Hand Washing campaign. They gave us the 411 on the campaign's game plan and goals, and now we'll hear all about proper hand washing technique, and we'll also have a chance to answer some of your frequently asked questions. Our next guests are again from the Monterey County Public Health Bureau. Joining me now is Johanna Latham, registered nurse, and Lydia Ruiz, public health nurse. Welcome, ladies, and thanks again for being here.
Thank you, Emily.
So I understand that you two are also part of the Clean Hands hand washing campaign, correct?
Right. Yes.
Very well. So what are each of your functions or roles within this hand washing effort?
Well, both Johanna and I are public health nurses with the Monterey County Health Department. We've played an active role in providing community outreach about the importance of hand washing, and had our teachings demonstrated back with having our clients actually wash their hands and show us how they do what we taught them, the appropriate technique.
Very well. So you got some feedback on what you taught them, and then it was like a teach the teacher, train the trainer type thing. So they taught you, and there you can verify that they're doing it right and they're getting the messages. And very well. So what is effective hand washing?
Well, effective hand washing is the act of cleaning hands by applying soap and water, rubbing them together, rinsing them with clean water, and thoroughly drying them. The process gets rid of germs, and every hand washing stage is important and effectively contributes to the removal of soil. And the most important part for us is the reduction of microorganisms that can lead to illness. Since this project was born around the area of, or the time of the flu season, that was our priority, to decrease the amount of illness in the community.
Okay. Very well. And as we heard from the previous segment, that this started September of last year, so it's been about a year. And in that year, we saw the seasonal flu, pandemic H1N1. So there was many things to prevent, it sounds like.
Right.
You guys were busy. So when should hand washing take place exactly?
Well, it's very important that we wash our hands whenever they're visibly soiled. Most importantly, after we use the restroom, before we eat, if we cough or sneeze, wash our hands. Likewise, if we're caretakers, it is important to wash our hands before we cook, after we change, a baby's diaper, and just whenever they're visibly dirty.
I see. And so can hand sanitizers be used as adequate hand washing, or is this in complement to soap and water, or when do you use hand sanitizer, and is it adequate for hand washing?
What we've been teaching is that hand sanitizers are a great addition to hand washing. Of course, we prefer that there is a hand washing station and that you use the soap and water, but not all the places have that. So as part of our campaign is facilitating the hand sanitizer so that when there is no adequate facility, that you can use that instead and still reduce the amount of infections.
But not as good as...
Right, it's still better to wash your hands.
I see. So in terms of washing your hands, which is better to use, the liquid soap or the bar soap?
Well, liquid soap is generally recommended over bar soap, and the reason why they recommend the liquid soap versus the bar soap is because the bar soap can grow bacteria, especially if it's in a public place. A lot of people can use it. You don't know if they have infections in their hands or if they have other stuff that can potentially grow. So they recommend the liquid soap because you can pump it, use it, and there's no sharing per se.
So you're saying that bacteria can live on soap?
Right.
Which is supposed to clean you?
Right.
Oh no. So it sounds like, from what we've just learned, that hand washing is really important, and you do this to get rid of germs. You do this before you eat, before or after you use the restroom, change a baby's diaper. It's preferable to use soap and water if available, but hand sanitizer does a good job as well of hand washing, correct?
Right. That's right.
So then in terms of the soap, I'm interested. So you just said that germs live on soap, so it's better to use the pump liquid soap instead of the bar soap. So what's the difference then? Which is better between antibacterial soap and plain soap? What's the difference there, and which one is better?
Well, you know, according to the CDC, the Center of Disease Control and Prevention, there really is no evidence that shows whether antibacterial soap is more effective to reduce, you know, the incidence of illness in comparison to just regular liquid soap. The importance of using soap when you wash your hands is really to get that, that good lather in order to do the friction, and then following the steps that we'll talk about in, you know, in a while. It really helps to remove to allow for the easy removal of those germs on your hands.
Okay, so you did mention that you're going to show us. Lucky enough are we today to be able to have a demonstration, and we'll get to that in just a moment. But more about the soap and the water, and I've heard a couple times now you should wash your hands to get that good lather for 20 seconds, happy birthday song. What's the situation there?
Well, what we've been recommending, well, the CDC recommends at least 30 seconds.
Oh, okay.
Which is about as long as it takes to sing happy birthday 2 times. A lot of kids like to count 1 to 30. A lot of other kids sing the Twinkle Twinkle Little Star song.
Oh, I like that one, okay.
It takes different tricks, but that's been our message, you know, at least 30 seconds. And most of the kids already know that, especially from the past pandemic flu. That was one of the messages that was really out there, so luckily they got it.
Shoot, it looks like I missed out on that one. Well, so that's 30 seconds and happy birthday twice, right?
Right.
Okay. So in terms of this washing with soap and water, we've talked a lot about soap. Is there any specifics in the water, amount of water, water temperature, anything we need to know about the water?
Well, the CDC again does recommend that the water temperature be set at 98 to 110 degrees Fahrenheit.
Oh.
And the reason why they recommend warm water is mostly because the warm water in combination with the use of soap and the vigorous friction does allow for the easy removal of those germs, and obviously the warm temperature helps in killing those germs.
Okay. So the warmer, the better, pretty much. I mean, we don't expect folks to have thermometers on them all the time, but you can feel the water getting warm, and you know, then you know it's time to lather up, right?
That's correct.
So I think that we should kind of stop talking about it and see what it looks like firsthand. So we're going to do a demonstration here. I see you have your materials set up right here, and I'll let you guys go ahead and show us what you've got there.
Sure.
You'll have to take your mics off. Emily,
Alrighty then. So the public health nurses, Lydia and Johanna, here are going to get up with our volunteer, and they're going to do their demonstration of hand washing right now. And as you can see here below me, we've got a nice big poster of some of the germs that you've got on your hands, and this is when they become soiled, and when you know you should wash your hands, is what we've got here. And so we'll go ahead and move that so we can get a better picture of what's going on in the front of us. And again, this is a hand washing demonstration by the public health nurses from the Monterey County Health Department and our lovely volunteer here. And so we'll let them take it away, and we've got 2 buckets here set up. It looks like one of them has some clean water in it, and the other will be the bucket that she puts her soapy hands in.
And we did not have the soap with us today, but we will just demonstrate the proper techniques.
Okay, so I understand that they did not have the soap today, but they'll just demonstrate the proper techniques of the hand washing, which again is 30 seconds, happy birthday twice. And the water right now is running.
So it's recommended that they obviously wet their hands, and then with in combination with soap, begin the vigorous movements.
So again, it's recommended to wash your hands, mix it with soap, and when the water gets warm, if this was a sink that we're using here with the temperature dials on it, then she'd rub her hands vigorously, and the soap would then begin to lather up. And Lydia, anything else here?
And as Johanna here is teaching Mia, you have to run through various different movements. Obviously what we recommend is vigorous friction, You alternate between the fingers. Use your nails to scrub the bottom of your palms
Okay.
and get around your wrists also. And so we alternate that for the 30 seconds. And then once the 30 seconds are complete, you can just rinse and then towel dry and turn off the faucet with the paper towel.
Okay, so that's interesting. You mentioned a couple tips. Can you kind of go over those one more time? When you have the soap lathered up in your hands, you want to use, I heard, your fingernails against the palm of your hands?
That's correct. And just kind of gently use the fingernails to scrub the bottom of your palms. Again, use one hand to get between the fingers of the other.
Okay.
And scrub. And then you may want to make sure you get all the way up to above wrist level.
Above wrist level, okay. And this is all part of the 30 seconds. That seems like a pretty, busy, there's quite a few things to do there in 30
Yes.
seconds. And I liked how you mentioned then you want to towel dry your hands when you're done, and then turn off the faucet with the towel
With
on
the
your
towel,
hands.
that's correct.
Okay.
And obviously this is part of what we teach and why we have them do a return demo to verify that they got the technique down.
Oh, okay. So does our volunteer seem like she has it down there?
Of course.
Excellent. So, and this is also the beginning of the very early stages of the Clean Hands Hand Washing campaign that Faye and Linda mentioned earlier.
That's correct.
With the buckets, and you can see that for little to no cost, we can teach, effectively how to wash hands. So, thank you so much, ladies, for that demonstration.
Thank you, Emily.
Okay. So, I hope you enjoyed this hand washing demonstration. At this time, we're going to take a short break, and you're tuning in to Your Health radio and television program, so don't go away. We'll be back in 2 minutes.